wanted to give a quick example of how I use the vital organ dynamics models to help me do some treatments. I just got done with a session and I was treating a young person who's an athlete who has some upper GI issues that are genetic in origin, and he came in today complaining of some restrictions in his chest after he took a strike to the chest, and also some restrictions that he's noticed when he tries to do cervical rotation as part of his homework. And what I saw was that there was a lot of irritation to his esophagus, and I wanted to try to find a way to support the esophagus in a way where it can kind of decompress, both neurally, reduce the irritation in it, as well as physically try to adjust its position so that it's usually sitting in its more normal, more posterior position rather than being pulled forward from the discomfort. And so I had a couple of different options. One is to support it directly via the yin-yang relationship, which in this case is the spleen-pancreas relationship to stomach and and esophagus. But it seemed like it was too irritated even for that. That seemed too direct. And so I used what I call the grandmother relationship, gallbladder to esophagus. And I had a couple of different options. One was to sort of physically approximate, bring the gallbladder physically closer to the esophagus, but that also seemed too direct. So I then actually went to his ankles and approximated the gallbladder meridian to the stomach meridian, simply bringing the tissue from the gallbladder meridian closer to the tissue that is along the stomach meridian, sorry. And I did that unilaterally on one side and then the other, and then that actually allowed him to decompress the irritation in his esophagus, and it gradually shifted more posteriorly as I was doing the holes. With his respiration, I could watch his chest actually drop, and he could feel the tension in his chest decrease. All right, so there's one example of how to use vital organ dynamics as a model for applying orthobiotomy techniques.